Once when I was pregnant, I went for a run, and this sometimes happens when running. I needed to use the bathroom. After sitting in the bathroom for a bit, I developed tunnel vision as the room darkened around me. I've fainted before, so I knew to get down quickly and with my head on the ground, quickly recovered. But that quick recovery happened because I'm pretty healthy. But in our children with complex congenital heart disease, or poor function, or both, a bowel movement can lead to something called the poop of death, the POD. While everyone who works in pediatric cardiac critical care eventually becomes acquainted with the POD or its physiologic cousin, the BBE, barf-Brady ECMO, trying to do a literature search on this phenomenon comes up with some weird but unhelpful stuff. But after talking this over with some of my friends and thinking about this, I think the likely physiology underlying death by pooping in babies with cardiac disease mirrors what we see with the Valsalva maneuver. So let's talk about that. The Valsalva maneuver is defined as a forced expiration against the closed glottis, so trying to push a breath out without actually releasing any air. We do this naturally when having a bowel movement or pushing during labor or weightlifting. The Valsalva maneuver is named after Antonio Maria Valsalva, who first described it in 1704, and the first Valsalva-induced blackout was reported in 1850. Straining results in marked increased interthoracic pressure. This has two effects. First, the compression of the interthoracic aorta activates the aortic baroreceptors, which decreases heart rate via the vagal nerve. This increased pressure in the chest also reduces venous return to the right atrium, and this decrease in preload decreases stroke volume. Since cardiac output is stroke volume times heart rate, the decrease in heart rate and the drop in venous return results in decreased cardiac output. For you or I doing a Valsalva maneuver, continued straining then leads to a rise in heart rate as the body tries to compensate for the lower cardiac output. We then take a breath, reestablishing venous return to the heart, which causes a short-lived overshooting of the blood pressure and dropping of the heart rate. And then we are fine. But sometimes our babies don't recover, thus the poop of death. Maybe the drop in cardiac output leads to poor coronary perfusion, which wouldn't be tolerated in a struggling heart. Pulmonary vascular resistance will be increased, and in children with surgical systemic to pulmonary shunts, that means decreased pulmonary blood flow and worsened cyanosis. And there's increased systemic vascular resistance, increasing afterload to the systemic ventricle. All this adds up to a risk of cardiac arrest with bowel movements, emesis, lab draws, or significant agitation. I don't want to scare you. This is rare, but it does happen. So what can we do? Well, we can't stop a baby from pooping, and sometimes they're going to need blood draws. I honestly don't know if there is a good way to prevent this, and is usually so abrupt it's hard to stop. If the patient still has temporary pacing wires in, we can pace to increase the heart rate. They need preload, so bolus fluid if you can. But really, these events sneak up on us, and once they've started, there's not much to do except good resuscitation. And this can happen outside of the hospital, where there's nothing we can do. And so then we get to the uncomfortable truth that sometimes our patients just die. You can do everything right and still lose. And that sucks and that hurts. But then I remember that in the year I was born, the survival for complex single ventricle heart disease was essentially 0%. The Norwood procedure hadn't even been reported yet. By the time I started medical school, babies born with hypoplastic left heart syndrome had a survival rate around 40%. And now, 70% of babies are making it to 5 years of age. Part of this is due to advancement in surgical technique, but a lot of the improvement is in our ICU care. We did that. So if you ever find yourself crying in the ICU bathroom, remember how far we have come and that you play a role in every success story.